Welcome to this Canadian Cancer Society webcast. Smoking, there's always a reason to quit. This webcast is generously supported by RBC, Merck, and AstraZeneca. My name is Lacey Horta. I'm a Cancer Connection specialist and the moderator of cancerconnection.ca, and I'll be your host today. In this webcast, we'll be having a discussion with Monica Bennett, Regional Coordinator with the Canadian Cancer Society Smokers Helpline. Monica has 10 years of experience in the field of tobacco control as a key resource for healthcare cessation partners. A successful counselor, trainer, and manager, she's developed facilitation and training resources that have reached hundreds of people. Monica has created successful partnerships and assisted in the development of policies and practices that improve personal and organizational health. She has another 20 years of rich experience in the not-for-profit sector focusing on community development, sexual health, gender justice, and AIDS and HIV education. Welcome, Monica.
Thanks so much, Lacey. I'm happy to be here.
Thanks. In today's webcast, we will be discussing reasons to quit tobacco use, including the positive effects quitting has on cancer treatment, and different ways to quit. Before we get started, I have a few housekeeping items. The presentation screen you have in front of you is fully customizable. You can increase or decrease the size of the various windows, including the main slide area, speaker bios, volume control, and the question submission window, by left-clicking and dragging any of the corners. From time to time, we'll be referencing some useful resources or links to websites that inform our discussion. Please click the resource widget on the bottom of your screen to get access to these resources. We've set aside some time at the end of the presentation to accept your questions. Please submit your questions at any time using the Q&A widget at the bottom of your screen. Please note that Monica will not be answering personal medical questions. If you have any issues with technology, click on the Help widget, the question mark. Now, with all that out of the way, I'd like to welcome Monica Bennett.
Thank you. I'm going to be starting with a couple of poll questions, and the first one is, let me find it for you. The first one is, have you ever used tobacco in your lifetime, even once? Oh, no, that's not the first one. You will be getting that question secondly. But the first one is we want to find out a little bit about you, who you are at the other end of the line. Are you a cancer survivor or a cancer patient? Are you a caregiver or friend? CCS staff member, a CCS, that's Canadian Cancer Society volunteer? Are you a health professional or other? Give you a minute or so to do that. Okay. Oh, look at this. Let's see. Oh, there's lots and lots of healthcare professionals out there. Some Canadian Cancer Society staff. Hello, my friends, because some of you might be my workmates. And some other folks. I wonder who the other folks are. We'll find out. You can let us know in the chat box later if you like. And as I said, the next question is about tobacco use in your lifetime. I'm going to be asking you about that. And just know that we're not keeping track of you. We don't know who you are, and there's no way to identify you with your tobacco use. And I say that because we know that there is, unfortunately, there's some shame and stigma that's sometimes associated with tobacco use. And so we want to make sure that you don't feel that way, because we're not judging you. And just like last week's, Let's Talk campaign, we're trying to get rid of some of the stigma associated with tobacco use. So, have you ever used tobacco in your lifetime, even once? If you want to answer that, yes or no. Let's see. Okay, 55+% of you have used tobacco even once, and 44% have not. That's interesting, right? Even as many healthcare professionals and Cancer Society reps, even us folks, we have even used tobacco, and we'll see more about that, about how we are lured to use tobacco and how tobacco keeps us hooked. So let's go to the next question. Have you ever quit using tobacco, even for a day? Maybe you've quit for good, or maybe you just quit for a little bit. Have you ever quit using tobacco, even for a day? Look at that. That's great. That's the folks, 77.8% of you have quit using tobacco, perhaps even for a day. Others have not quit using tobacco. So that either means they're still using tobacco or they never used it in the first place, so they didn't have to quit. That's interesting to see who's all out there. Thank you for doing that. And for those of you who did make a quit attempt or have maintained that quit status, congratulations. Those folks are jumping in the air because they are celebrating, and there's a reason to celebrate. Every attempt counts. Even cutting out a cigarette or two per day is considered an accomplishment. And in fact, if we look at the research, we know that a serious quit attempt, what we think of as a serious quit attempt, is actually just 24 hours. So knowing that it takes just quitting smoking for 24 hours, rather even compared to quitting for a lifetime, 24 hours is a serious quit attempt. And I think that is indicative of how tenacious the nicotine addiction is, that 24 hours is considered a serious quit attempt. What we know is that even people who have quit intermittently have health benefits over those who continue to smoke. So even if you continue to smoke, even if you quit for a day and went back to it, you quit for a week and you went back to it, you quit for 6 months, you quit for 6 years and you went back to it. Even if you quit for half a day, there are benefits associated with that. So it does make a difference, and we're going to look at some of that. And some of that difference is just knowing that you've quit and that you can do it, because sometimes there's some fear associated with quitting. It's not so much just the addiction itself, but it's the fear of failure that is part of the reticence behind not quitting. And so for people who have quit for just a short period of time, we want to congratulate you. We want to keep you going on with some of that confidence. So here are some of the reasons that some of the benefits of quitting, even for a short period of time. Some of you know this already, but even you just stop smoking for 20 minutes and your blood pressure drops back to normal. In 8 hours, the carbon monoxide level in your bloodstream goes down by half, and your oxygen levels actually return to normal. And that'll be important, that oxygen level, when we talk about cancer treatment. So keep that in mind. In 72 hours, your bronchial tubes start to relax and your energy levels start to increase. 2 weeks, your circulation increases and it improves over the next 10 weeks. In 3 to 9 months, coughing and wheezing and breathing problems will dissipate, and your lung capacity improves as you go along. And that coughing and wheezing, some people get discouraged by that because they quit smoking and then they find themselves coughing even more, thinking, I'm doing something good for my body. What's happening here? What we know is that your body is like such a resilient mechanism, and like all parts of it. And so what's happening when you quit smoking, as the cilia, the tiny little hairs in your lungs, they start to get free. They start moving a little more, and they've been flattened down by the tar that accumulates when you smoke tobacco. And so what happens is those cilia start to move again, and they're doing their job. They're moving the bad stuff out of your lungs, and that's why you're coughing. And so you might cough for a little while. It could be annoying, but if you reframe it and think of it, this is why I'm doing this. My body was healing itself. That can make it a little easier. After a year, your risk of having a heart attack is dropped by half, and after 10 years, your risk of lung cancer will have returned to that of a non-smoker. After 15 years, your risk of a heart attack will return to that of a non-smoker. So it just keeps going and going. Every attempt counts, and every attempt you make is an important opportunity to learn from that experience. So it's not whether you were tobacco-free for a day or for a week or for a year. The important part is that you tried, because you've tried, you've made benefits to your health, you've made benefits to your psychological health and your confidence, and that's what counts. So that's what we say is, don't quit quitting. Other benefits, you are increasing your life expectancy. So if you quit smoking before you're 30 years old, you will have gained 10 years of life. If you quit smoking before you're 50, you gain 6 years of life. If you quit smoking before you're 60, you've gained 3 years of life. And 3 years doesn't sound like a lot, but if you've got grandchildren, if you have friends and meaningful relationships and meaningful work and people and your sense of geography, your community, those 3 years are important. What we do say, though, is that generally I often don't actually tell someone under the age, or actually probably adolescents, teenagers, and young adults, I wouldn't necessarily tell them that if you quit smoking by the time you're 30, you're going to gain 10 years of life, because when you're a teenager, you don't really necessarily, it's those, you have this sense of being immortal or invincible. And so you think, oh, that's okay, I'll wait till I'm 30. And then by the time you get to be 30, it becomes really difficult to quit, and then it's even harder. So best to quit as, sooner than later. So if any of these benefits don't necessarily speak to you, then we'll look at other benefits. Importantly, if you quit smoking, it reduces the chances of the cancer that you do have from coming back, because smoking is affecting all the cells in your body, all the systems in your body, including cancer. So if you quit smoking now, the chances of your cancer returning are diminished considerably, and it also reduces the chances of you getting another form of cancer. So even though you may have beat this cancer, we know that cancer is not just one disease, it's many, many diseases, and so it reduces the chance of getting another form. So, and we can't really emphasize it enough. It's never too late to quit, and you may as well keep on trying. Some people sort of get discouraged thinking that when they have a diagnosis of cancer, that it's really like I've done it now. I can't do anything. There's nothing. I'm just going to keep on doing what I'm doing. But really, nothing could be further than the truth. It's never too late, no matter where you are in your cancer journey. So let's look at some of the reasons that people have for quitting tobacco. Lots and lots of reasons, including these health benefits, but some other ones. So here's another poll for you. Why, if you are a tobacco user, why do you want to quit? Or if you're not a tobacco user, what would be a good reason for you to consider to quit smoking? What do you think is a good reason for quitting smoking? There are health benefits. You may want to prevent disease. There's financial concerns. You save money by not buying tobacco. Some people like to look better, to smell better, to feel better. Some people just don't like the sense of being dependent on tobacco, so they want to reduce that sense of dependency. Other people just find it's harder and harder to smoke, right? You have to go outside to smoke, and if you're in a workplace where it's a long way out the door, it just becomes more difficult to smoke. You also might want to reduce your insurance costs. I know that people who are non-smokers have reduced insurance costs. Other people quit for their family and for their children, and older adults often they're quitting for their grandchildren. And related to that is they want to be a better role model for those folks around them. And not unimportantly, people often quit for their pets. They like to, because pets are also affected by secondhand smoke, and so they want to reduce the exposure of secondhand smoke on their pets. And there are as many reasons to quit smoking as there are people, so there's the other category as well. See what you guys said. Most people said health benefits, which makes sense given who you are and why you're on this webinar. People, 23.8% said to prevent disease. Financial concerns, almost 5%, and a big chunk of people, family and children. We're down there, and a little bit of other. That's interesting. I wonder what the others are. There's always good reasons to quit. Thank you very much for that. So now I'm going to look at tobacco and nicotine. I want to look at this so that we want to explore some of the background on what tobacco is and how nicotine works, so that you're better able to understand the complexities of tobacco use. Because we often, some of the stigma that comes with using tobacco is that people think like, what? Like, come on, aren't you? Like, everybody knows tobacco is bad for you. There's not, and many people out there who don't know it's bad for you, but just because you know something doesn't mean that you can change it, right? And so we're going to look at how complex that is and why it is that it can be difficult to quit. So here's a little bit of background. That picture that you see is a tobacco plant. When it's fully grown, it's probably about between 5 and 6 feet high, maybe a little bit taller. But the tobacco contains many chemicals, as all plants do, but tobacco in particular contains nicotine, and that is the addictive substance. There are two kinds of tobacco. I want to mention that very importantly. There's traditional tobacco and commercial tobacco. In this webinar, we're talking about commercial tobacco, meaning the tobacco that's sold for for use by the tobacco industry. Traditional tobacco is used by indigenous people as one of the four sacred plants, and it is not used in the way that we would use it in a cigarette or a cigar, for example, but rather it's used in rituals and in healing ceremonies. So we're making a distinction between those two. And as I said, nicotine is a major addictive component of tobacco. So let's talk a little bit about nicotine. We have to understand that since nicotine is the substance that one is dependent on, there's three parts to being dependent on nicotine. There's the physiological part, the social part, and the psychological part. So the physiological part is that the biological dependence, what we'll talk about a little bit later, you'll see in the next couple slides. The part that tobacco users are often familiar with is the social part of it. Like it becomes something that you do. There are behaviors associated with tobacco that aren't necessarily associated with other things. So, for example, you always smoke with your sister because the two of you like to sit down and chat while you're smoking, for example. It's a very social part to it. And there's also the psychological part of it. The psychological part is the sense that, I can't do this. I'm so used to doing X, Y, Z while I'm smoking. So you've associated behaviors. So you have to have coffee and cigarettes together, for example. And importantly, I'm going to read this quote for you from Philip Morris. Why do people smoke? Smoke to relax, for the taste, to fill the time, for something to do with their hands. But for the most part, people continue to smoke because they find it too uncomfortable to quit. They find it too uncomfortable to quit. Now, Philip Morris, you may or may not know, is not a person. Actually, Philip Morris is a company. It's a tobacco company. And that quote was found in some of the papers that were subpoenaed back in the last century when we were trying to prosecute the tobacco industry. So the tobacco industry has known for a long time about why people use tobacco. They know that it is an addictive substance, and they are exploiting that addiction to make money. So here is a very small little science of nicotine dependence. What happens is that nicotine, when it's introduced into the body, the fastest way it gets to the brain is through smoking. The fastest way as opposed to getting nicotine in other ways, through the patch or through gum, as we'll talk about later. But nicotine, when you inhale it, the nicotine goes to the brain in 7 to 10 seconds, and it binds to the nicotinic acetylcholine receptors. So the receptors in the base of the brain, which you see down there towards the brain stem. And from there, it goes on the reward pathway down to the nucleus accumbens. I am not a scientist. Accumbens, and I'm sure there's folks out there who can pronounce that better for me. But the point is that dopamine is released, and that stimulates the reward pathway. So that same reward pathway is seen in other addictions as well. And so the point that we're seeing here is that nicotine actually changes your brain. It's changing your brain chemistry. Your brain is getting used to getting that boost of nicotine. So every time you inhale, you get a bit of nicotine. Every time you get a bit of nicotine, you get a little buzz, and dopamine's released. And who doesn't want that, right? That's what the tobacco industry knows. It knows you enjoy smoking. People don't smoke because they don't like it. They like it for a good reason. And dopamine, as I said, is a reward. And what we know about dopamine is that dopamine is also released for other things like for food and for water and for sex. In other words, the dopamine is released. When that's released, your body thinks it needs these things to stay alive. You do need food to stay alive. You do need water to stay alive. We need to reproduce in order for the species to stay alive. And so that's really what your body is thinking when it goes through withdrawal. It thinks, I need this to stay alive. And it's not I'm being a little dramatic, but that is basically what's happening. And of course, the good news is your body will not die without nicotine, unlike those other things, right? And the other good news is that nicotine is not a carcinogen. It's not going to harm you. It's actually quite a benign stimulant. It is a stimulant, and it's very addictive, but and other than that, it is a benign substance. It is not a carcinogen. There are thousands and thousands of other chemicals in tobacco smoke and in tobacco products in general, and it's those things that are actually responsible for the vast majority of tobacco-caused diseases. So it's really the products of combustion. It's the smoke that causes much of the problems, and some of the chemicals that are in tobacco that have been put in by the tobacco industry, either to process the tobacco itself or to increase the addictive potential of the nicotine, things like acetone and arsenic, cadmium, choline, formaldehyde, the list goes on and on. There's up to 4,000 chemicals, and other research is showing us 7,000 chemicals because they're getting really good at this. And so it's not the nicotine that's making you sick, it's the smoke and all the other chemicals that are making you sick. The other part of nicotine dependence is, as I said, it's the other behavioral associations that go with it. So part of it is just the actual act of smoking. So we know that on average it takes about 10 puffs to smoke a cigarette. So 10 puffs times 25 cigarettes in a pack times 365 days a year makes 91,250 puffs every year. So you are doing that hand-to-mouth behavior over 90,000 times a year. You probably don't do anything more. There's nothing else that you do more than that probably except for blinking, and that's an involuntary action. This is a voluntary action, and it really, so your body's becoming used to it, right? And that's part of the psychological sort of association that comes with it. That's one of the things that can make it difficult for people to quit. The other things that go with it are other associations like coffee. There's coffee and cigarettes. We know that goes together. Alcohol and cigarettes go together. We often know when people relapse or slip, there's alcohol associated with it, or it's a social occasion. They're out with other folks who smoke, and so those associations that picture depicts. We also know that people often smoke after a meal when they quit, or people often smoke when they're driving. That's another association. We also know that when people are depressed or anxious, they will also smoke because there's just an association there. We know that people who have a diagnosed mental illness are far more likely to smoke, and sometimes they're doing it because, you know what, that they're getting a little hit of dopamine. So if you're feeling kind of depressed, something that gives you that little kick up, that little buzz, it's understandable that's what you would be doing. There's also rituals associated with tobacco use. So people get used to it, especially over time, like opening the package, handling the cigarette. For people who use spit tobacco, tapping the tin and then getting the tobacco out, the ritual of lighting a cigarette, drawing on it, being in familiar surroundings. People often associate tobacco use with emotions too, and so they get used to it. So if it's a happy time, I'm going to celebrate. I'll have a cigarette. If it's a bad time, it's a stressful time, I'm going to reward myself. I'm going to have this little cigarette. So there's all kinds of associations that come with it. And then on top of that, we have the tobacco industry, who is playing on all of our insecurities to make us do that. So what you're seeing there are three. The first one on the far left is that's an ad from a long time ago, probably in the 50s, when dentists actually were recommending Viceroys and doctors were recommending Camels. And so if a doctor was telling you it was okay to smoke, then they're using the authority, the power of the trust and authority that those folks had to get you to smoke. The second one you see there is an example of the kinds of things that the tobacco industry has done. They're really good at researching and manipulating their products to make them more addictive. So, for example, when we started to look at eliminating menthol from cigarettes, they took the menthol out of the tobacco, but then they put the menthol in the filter. So what you do is when you're holding it, you press on that little whatever that is, that little button inside the filter, and it would release menthol. Pretty smart. I have to give them credit for that. The third one you'll see there, that's an ad that was done only a very few short years ago in a magazine called The Advocate. It's a magazine that's in the States, available here in Canada. It's for the LGBT community, the lesbian, gay, bisexual, transgender community. So this is really looking to market tobacco to a very specific and a particularly vulnerable community. The tobacco industry knows that those who are more vulnerable are more likely to take up cigarettes. So we see it for the LGBT community, we see it in racialized communities, we see it in mental health communities. The tobacco industry has marketed directly to those folks and helped them get addicted. So given all that, I'd like us to reframe this. I want to understand nicotine dependence and tobacco use differently. So when you see these pictures, what we often think is we often judge people, especially for people who are sick, right? We think, oh, they're sick with cancer. How could they possibly smoke? Don't they know any better? Or we see, or pregnant women in particular are often ostracized for this. How can she do this to her unborn child, we'll say. But you know what? Those folks, they are not weak-willed. They are not stupid. They know what's going on, but they are addicted. They're addicted. These photos, I think, speak to the strength of the addiction and to the sometimes overwhelming loss of control that some people can feel when they're using tobacco. So although the serious health consequences related to smoking are probably understood, they're still unable to stop smoking. And if we put that in context, when we start thinking about smoking as a chronic relapsing condition with a pediatric onset, then that we can think about tobacco use differently, because most of the people who start using tobacco start before they're the age of 18, and they're not. And for those of you who've ever used tobacco, I'm sure you didn't start it thinking, oh, I want to be addicted to this when I'm 55. It'll be fun, right? You didn't think that way. You were just thinking this is a cool thing to do. The tobacco industry made you think it was cool, and your peers wanted to feel included. Most people, that's how they start. A small minority of tobacco users quit permanently after their quit attempt, but the majority of tobacco users go through multiple cycles of remission and relapse. So they quit and they go back, and they quit and they go back, and they quit and they go back, and that's the normal cycle of events. And knowing that, we want people to know that that's normal and that you can learn something from every attempt. So all that said, knowledge is important, and knowledge can be powerful because it can help us make better informed decisions. So I'm going to move on to some other facts about tobacco use and cancer. So tobacco use is associated with 30% of all cancers. And when I say tobacco use, I'm including all tobacco products, including cigars, smokeless tobacco, or chew or spit, as some people call it, pipes, often pipe smokers. We don't see many pipe smokers anymore, but pipe smokers don't consider themselves smokers per se. Cigar smokers often don't think of themselves as smokers. They think of themselves as just having fun. Now I'm off on a fishing weekend, and that's what we do when we're away. We smoke cigars and we have fun together. It also includes hookahs and water pipes, which we're seeing as more and more popular. We know that that your exposure to tobacco and tobacco smoke when using hookahs and water pipes is quite large. And it also includes bidis and krediks, which are tobacco products used primarily in Southeast Asia. Of course, we find them here as well. So tobacco use of all those things are related to all of these cancers, including cancer of the lungs, the trachea, the bronchus, the oropharynx, the esophagus, larynx, stomach, bladder, kidney, ureter, pancreas, uterine, cervix, colorectal cancer, liver, and acute myeloid leukemia rather. So it is directly related to that. There's a causal relationship there. And as I said before, there are, in first-hand tobacco smoke, that is, that smoke that is directly inhaled by the user, it contains over 70 chemicals that we know cause cancer. Some of these chemicals can damage the DNA, which can cause the cells to mutate and to grow uncontrollably, and that itself promotes the development and the onset of cancer. So that's the direct effect. And, of course, the other toxins that are in there may not cause cancer itself, but they do serve to weaken the immune system. And the immune system, when weak, is less able to fight off whatever else is going on in the body. We do know that cancer, I've heard stories from women who have been told that, you know what, it's okay. You've got enough on your plate right now that, it's quitting smoking is just another stressor you don't need when you're under cancer treatment. And we know that nothing could be further from the truth. In fact, any changes that you're making are more likely to be successful if you're making changes at the same time. So we know that quitting smoking is one of the best things you can do to help your cancer treatment. It reduces the chance of the cancer coming back or from getting another form of cancer, which we referred to earlier. So whether you're scheduled to have surgery, to have radiation treatment, or chemotherapy, quitting smoking will make a difference on all those things. So more specifically, we know that when you're undergoing radiation therapy, remember I said to remember that oxygen piece? So this is the piece. Radiation therapy will work better if the level of oxygen in your body is normal. Because when you smoke, the level of oxygen in your body drops, and that makes it harder for the radiation to do what it needs to do. And so what we suggest is that if you can't stop smoking like for good, then at least stop smoking ahead of time. Avoid smoking before and after your radiation therapy. And we'll talk about where you can get some help to do that in a few slides here. In chemotherapy, we also know that chemotherapy drugs work better in people who don't smoke. Smoke has chemicals in it that reduce the level of some of chemotherapy drugs, making them less effective. And we also know that the inflammation from the tobacco binds to some drugs and makes them less effective. And so if you're like putting your all into you're working so hard, you're giving up so much to be treated with chemotherapy or any of these therapies, you want to give it the best chance that you can to get it to work. We also know that nicotine may cause cancer cells, make them rather less amenable to treatment. So nicotine can prevent apoptosis, which is like normal cell death. And so your body is trying to get cancer cells to die, and nicotine may prevent that from actually happening. So you want to make sure that you're doing what you can to improve your chances. Your third cancer treatment option may be surgery. And so we know that quitting smoking or reducing the number of cigarettes you smoke can make surgery safer and help you recover more quickly. That's true of any kind of surgery. The dentist will tell you that. You're having any kind of bone surgery, if you're having any surgery at all, we know that it makes a difference. It helps you, makes your surgery safer, and it also helps you recover more quickly. So that we generally ask that people having surgery try to quit at least 6 to 8 weeks before your operation, and because it will, among other things, it will make you will heal more quickly. So your wounds, this has been proven over and over and over again, wounds will heal more quickly if you don't smoke. You're also less likely to develop an infection, and so again, you're more likely to heal, and you're less likely to have complications before or after surgery. You may or may not get to go home faster and go home sooner, but quitting smoking is the best possible option, but quitting at any time is helpful. So when you're quitting, it's important not to give up, and don't be hard on yourself. Because it's like we all know that it can be really difficult for lots of folks, and as I said, you might have to make many quit attempts, and you're learning from each attempt, so don't be hard on yourself for this attempt. But just to give you an idea of what you can do is to, just in the short term, about thinking about it, is just change the situation. You can avoid or leave a place or a situation that you connect with smoking. So if you always go out for a smoke break with your workmate, maybe you can ask that workmate to go for a walk with you instead, or find someone else to go for a walk with. You do deserve a break. You just don't need necessarily to do it with and associate smoking with it. Importantly, we want you to think about how far you've come and do your best to keep going. Some people need to think about the long term, like what I'm going to look like, what the long-term goal is to quit forever, and that keeps them going and thinking positively. Other people just have to think in terms of 1 hour or 1 day, but always to think positively. And you might want to do something that makes it hard for you to smoke, like chewing gum or drinking water or keeping your hands busy. If you're knitting, I always give knitting as an example. Not that I know how to knit, but some people really, really like it. And so Just something to keep your hands busy, keep your mind busy, doing puzzles, working on the computer, if working on the computer isn't a trigger unto itself. Also, importantly, to ask for help. You don't have to do this on your own. You can talk to a friend. You can talk to a family member. You can talk to another tobacco user, a tobacco user who's going to be supportive. Some other tobacco users may not be as supportive as you might think because they might feel like they're going to lose their smoking buddy. So you got to be careful about who you're asking for help. Your healthcare provider, and as we'll talk about, there are quit lines across Canada, and we'll talk about those as well. And as I said, time and again, don't quit quitting. It's possible, and you can do it. So what we talk about is trying the 4 Ds, just to get through that one cigarette. There's the first D is delay. Just delay it. Just say, okay, I'm not going to have a cigarette for 15 minutes, and you'll be surprised. The craving will dissipate in that time. It's sort of like when I used to run, I would tell myself, I'm going to run to that stop sign, knowing full well I'm going to run to that stop sign and beyond. But when it was really, really hard, I'd just say, just go to that stop sign, and I'd get there, and then I'd keep going. So this is the same sort of thing. I'm going to delay. I'm not going to have a cigarette for 15 minutes. 15 minutes goes by, and guess what? You don't feel like having a cigarette anymore. Or you can distract yourself by choosing any one of a number of activities that works for you. Your quit program is going to be the one that works for you. So distracting yourself with going onto Facebook or distracting yourself with taking your dog for a walk, whatever it is that's going to distract you, that's what's going to work. Deep breathing is a really important one because what we have seen is that sometimes people confuse stress relief with smoking. So they are experiencing withdrawal, they get kind of agitated, and they think, oh, I really need a cigarette. And so they go and have a cigarette, and they take a big inhale in. And it's that big, deep breath that is actually helping them to become less. Sometimes the only time they ever deep breathe is when they're smoking. And so they associate deep breathing with relaxation, and they associate deep breathing with smoking. Smoking equals relaxation. The other piece of that is that they're experiencing withdrawal. They get a hit of nicotine, and of course, their withdrawal symptoms go away. So that's what they associate. So what they think is stress relief is actually withdrawal symptom dissipating. We also talk about the 4th D, drinking water. It's important some people really like to drink water. It replaces that hand-to-mouth behavior. It cleanses your body, keeps the toxins out, keeps you busy, all those things. So try the 4 Ds. The 5th D sometimes is dialogue. Talk with somebody. Find someone who's going to support you. And speaking of support is really important because we know that when you combine support and medication together, you're more likely to be successful. In fact, people who, for those of you who've tried it, and I'm sure many of you have tried to quit cold turkey, which is like just stopping and not trying anything else, but just sheer willpower. Quitting cold turkey you have about a 4% chance of being successful. 4% is pretty low. And what we have seen in our most recent evaluation here at Smokers Helpline, which is a service that serves Ontario and 4 other provinces in 1 territory, but our research is showing us that just with support alone through Smokers Helpline, you have a 28% chance of success. So if you add on to that some of the medications, the evidence-based medications that will help you quit smoking, you for sure are going to be far more likely to be successful. And some of that support can, as I said, come from Smokers Helpline, but I encourage you to talk to your healthcare professional, including pharmacists, nurses, respiratory therapists, whoever it is out there. And like many things, we just keep saying, ask until you get the answers you want. Sometimes there are healthcare professionals who aren't as well versed in tobacco control as others, and so they may not be able to help you, but there are folks out there who can. You can talk to folks at Public Health, wherever you are in the country. There are many quit lines there are quit lines that cover the entire country. There may be family members or friends who can help you. If you're employed, I encourage you to check out if there's anything through your own workplace that might be helpful. There's perhaps if there's an occupational health department, you can talk to them, or perhaps a benefits program at your workplace includes some of the medications that are useful. So for those of you who have ever tried to quit, this will look familiar to you. So this is what it looks like. That's what, in the first little while, most people will, the irritability and aggression, that will last for about 4 weeks. The depression that happens is not uncommon, and that's often because, as I said, you're not getting your dopamine, and you're giving up something important. For lots of people who have been using tobacco very regularly for a long time, they're giving up sometimes a friend, and that can be a hard thing to do. Poor concentration, increased appetite is very common, and that's partly because your taste buds are alive again. Your sense of smell has improved, and sometimes people want to replace a hand-to-mouth behavior, and so they're filling their mouth with food in order to do that. So you got to be careful with that. You want to be careful, make sure you're making healthy choices, and donuts are great, but not every day, right? So you want to try other healthy options. Constipation, nighttime wakings, mouth ulcers. Again, that's your body just trying to get ready. It's resilient, and it's trying to heal itself. So those are some of the things that you can sometimes expect. That's what nicotine withdrawal can look like. And so, in order to help you with some of that, we suggest that you can tough it through. You can white knuckle it if you want to, but it's easier if you use nicotine replacement therapy. And by that, I mean patches, gum, lozenges, there's a quick spray, it comes in a number of different forms. So there's that, there is bupropion and varenicline, and the important piece is to find the one that works for you. I mean, I've heard all kinds of crazy stories about how people quit, and what I have learned is that everything works for somebody. Some people will just swear by the cinnamon sticks that they chewed on for those however many weeks. But we know that's not like evidence-based science, and at the Cancer Society, we recommend only evidence-based treatments. And so what you're seeing here, the nicotine replacement and the other two medications, those are the only ones that we know that have been scientifically proven to work. So we know that tobacco is really complex, and so there's many factors that is going to affect the efficacy of your quit attempt. And as I said before, it can take up to 30 attempts before someone may quit for good. So don't quit quitting, and every time you quit, find out, reflect back on that and find out what works for you. What worked for you? Did those cinnamon sticks work? Then go for it. Try it again. Did drinking water work? Did going for a walk work? Did that nicotine replacement work? And if it didn't, find out why, because oftentimes we know that it's because the nicotine replacement wasn't used correctly according to instructions. That's why it didn't work. So people will say, I got the hiccups, or my stomach was so upset when I used the gum, and that's because they were using it incorrectly. So I encourage you to find out more about that. What you see here is one of the health warnings that we see on cigarette packs. So if you're buying cigarettes that are not contraband cigarettes, you'll see a health warning on it. It takes up about 75% of the package on there. And we chose that one because some of them, for those of you who are familiar, you'll see there's some more graphic picture warnings than those, and this one's pretty tame considering. But you'll also see at the bottom there, it says need help to quit, and then there's a number there, the 186 number. So what we know is that that's if you call from anywhere in Canada, that you will reach a quit line somewhere in Canada. So if you're calling from Saskatchewan, Manitoba, Ontario, New Brunswick, PEI, or the Yukon, you will reach Smokers Helpline. If you'll reach the other provinces, Quebec, Alberta, BC, Newfoundland, Nova Scotia, Nunavut, Newfoundland, they all offer a quit line. They'll offer their own separate quit line. I encourage you to talk to them. They're quit coaches. It's not like press 5 for nicotine withdrawal. You'll actually get to talk to a real person. They are non-judgmental. It's a free service. It's confidential, and you get one-to-one support. And that non-judgmental piece is really important because we know how difficult it is, and we know that it takes a lot of courage and a lot of work to get you to your goal. So quit coaches can help you make a quit plan, help you figure out how you're going to cope with cravings, talk to you about all the different quit methods that are out there and available, talk to you about withdrawal symptoms. You might not know that what you're experiencing is actually withdrawal and it will pass. how to manage stress, because often people use tobacco to manage their stress, so you talk about different methods of managing stress, and they'll help you find other services that are available in your community. What we know here, because I'm calling from Ontario, I'll tell you what I know about the Ontario line is that 90% of our clients have taken some form of action towards quitting after having used our service, and 94% of them would recommend our services to a friend. And so that speaks, I think, very highly to who we are and what we do. There are other ways that you can connect with us. This is Smokers Helpline Online. That's the homepage, and if you go there, you can walk yourself through and talk to other people who are quitting smoking. There are web pages like this across the country, but I encourage you to go on there and talk to other folks because, in my experience, the chat rooms are particularly encouraging and supportive, and they want you to succeed, and they will help you get through those tough times. And then when you become one of the people who have got through those tough times, then you can go back and help others do the same thing so that your experience will have meaning for others as well. What you see here are some great booklets. They are produced by the Canadian Cancer Society and available all across the country for smokers who want to quit. As you can imagine, is a thicker booklet, and it talks about some of the stuff that we talked about here, and it's a workbook, and it gives you even more tips and tools. You can walk yourself through it, and it's a great resource. Second one is for smokers who don't want to quit. For folks who are just thinking about it but they're not ready, it's a great resource because it's not judgmental at all. It's not telling you have to. You already know it's not good for you, and so just waiting for you to give you some thoughts, some facts, and some information to think about as you're considering it. And thirdly is a booklet to help a smoker quit. For those of you who have ever lived with someone or know someone who's quit tobacco, it can be kind of challenging and you don't know exactly what to say or how to say it, and so this booklet helps you be the best support that you can. So when you are out there, you can. So I encourage people to ask their healthcare providers to ask about tobacco use. And when you're out there talking to your healthcare provider, and I expect that I expect healthcare providers to ask about your tobacco use. Ask everybody about their tobacco use, and they're not doing it because they're judging you or they're trying to harass you. They're doing it because it's the best thing you can do for your health, regardless of where you are in your cancer journey or where you are in your life. The best thing you can do for your health is to quit tobacco, and so they're going to ask you about it. They're going to advise you to quit because that's their job. I often hear from smokers who say, well, they never told me I had to quit, so it can't be that important. And so I encourage healthcare providers to advise their patients to quit, and because patients will take that advice seriously. And if those healthcare providers have time, they will also assess where you are in your quit journey, and then they might provide you with some assistance or with counseling or pharmacotherapy. And when I say pharmacotherapy, I mean medications and nicotine replacement therapy. And at minimum, we ask them to act, to follow up, to set an appointment, to make a referral to somewhere, to some place or someone that you will get more assistance. So these, as you see, those are the 5 A's. And I'm telling you about this for those of you who are healthcare providers, just as a reminder, because I bet some of you know this already. And for you who are tobacco users or are on the other end of the spectrum, then you can expect this, and you're allowed to ask for help. It's important to ask for help because what we're trying to do is to get healthcare professionals to ask folks about their tobacco use and then help them in that, but also to get patients to ask their healthcare providers so that they'll be push from below and push from above, and eventually it'll all come together and everyone will be assisted in their journey to quit smoking. So next is, I want to know if there's any questions out there.
Great. Thanks, Monica. We do have some questions. It's now time to get to those. If anyone hasn't submitted their question yet, please do so using the Q&A widget at the bottom of the screen. And just note that Monica won't be answering any personal medical questions. So, Monica, our first question is it safe to quit cold turkey if you're a long-time smoker?
Well, that's a great question. I think it's is it safe? It's not going to hurt you. Like, it's not going to be there are no like long-term or even long-term side effects that are going to be harmful to you. The short-term side effects is you may experience those withdrawal symptoms that I referenced. They may be more intense for you. So though it's not bad for you, it's not necessarily the best way to do it. And that said, if it works for you, please do it. Because we also know that people sometimes make quit attempts that just out of the blue, they just wake up and say, yep, I'm going to do it, and it actually happens. And you may be one of those people. So it's not bad for you. It's probably more difficult. But yeah, people have to find the way to quit smoking that is best for them. And if that works for them, I'm happy for them.
Great. Thank you. Our next question is, when going through cancer treatment, is it harmful to be around secondhand smoke?
Well, it's always harmful to be around secondhand smoke. It's because there are all kinds of poisons in those. In fact, some of the chemicals that are coming off the end of a cigarette are more toxic than the ones that are being inhaled through the filter. One, because they're not going through that tiny little filter, and two, because what's on the end of a cigarette is not being completely burned, and so it's not being burned away, and so what's coming off at the end is worse. And so I think that whether you're in cancer treatment or not, secondhand smoke is always harmful. So you can ask the folks in your life if that's what's happening. If there's someone in your home who is smoking indoors, you can ask them to step outside while they smoke. Or if you're in a situation where you're being exposed to secondhand smoke, you can move to elsewhere, or ask them to move elsewhere. It can be a tough one because it's socially not necessarily easy, but you're doing it for the right reasons.
Those are some great tips. Thanks, Monica. Next we have, it's so hard to quit on my own. My family doesn't understand. What should I do?
Well, that's a hard one too, because oftentimes, when I said earlier, people quit, up to 30 times, and so sometimes the reaction that people get is, oh, you've quit before, or I've seen this before, as if it's going to work this time, which is really demoralizing. And so it's really important for a tobacco user to identify what it is that would be helpful. Sometimes we don't know that, but if you figure out for yourself what would be helpful, then directly ask those people. So it would be really helpful for me. I know it seems like it's hard, but if you would actually give me encouragement, or step outside when I'm trying to quit, or whatever it is that you need, be very explicit and ask that of the people around you. And if they're not being then if that's not working, then you're going to need to find other people who are going to support you, and that could be other friends, it could be a quit line, it could be your healthcare provider. Get support wherever you can.
Thanks, Monica. Our next question is the 12-step program developed by Alcoholics Anonymous used for smoking cessation? If not, can you tell us why?
I have heard about, they're often called Nicotine Anonymous, and they call themselves that full word, Nicotine Anonymous, as opposed to NA, because there's also a 12-step program called NA, and that's Narcotics Anonymous. So Nicotine Anonymous, I have heard of it. It's as successful as the people who work the program are. I would say that is probably true of any of the 12-step programs. There aren't that many out there. And I don't know about their success rate. But I also know that we often see, what we are starting to see is, so for example, Alcoholics Anonymous, they're kind of famous for going from alcohol to cigarettes, or smoking even more. And it used to be that, of course, you could smoke in those rooms, and now they have to step outside to smoke. And so we're seeing more AA groups that are non-smoking groups, right? Because they're trying to do it all at once. But as far as the Nicotine Anonymous groups go, I don't know. I don't have any information about their success. I don't know of any of the research around it. But as I said before, if it works for you, then it works.
That's right.
That's helpful.
Thank you. That is helpful. The next question is, do you have to get a prescription from your doctor for nicotine replacement therapy?
You don't need a prescription. It's available at pharmacy, but the important part is to make sure that you're getting the right amount of nicotine replacement. So if you are smoking 2 packs a day, for example, then using what we call on-label use, what it says on the label, well, the labels are changing actually, but it's important that you're trying to replace the level of nicotine, like slowly replace the level of nicotine that you're getting while you're smoking. And so we use nicotine replacement in what we call a clean delivery system. And so you're just going to get enough to make you feel comfortable, and then you're just going to slowly wean yourself off of it. So if you had 2 packs of cigarettes worth of nicotine in your system, and you're severely underdosing yourself by just putting on a 7 milligram patch, for example, or just using gum, you will not get much relief from your withdrawal symptoms. And so you want to make sure that you're using the right amount of nicotine for the amount of nicotine that you're trying to replace in your system. And so I encourage you to talk to a healthcare provider, a pharmacist when you go to the drugstore to pick it up, or wherever you're getting your nicotine replacement, ask them about proper dosage.
Mm-hmm. So it sounds like it's really important to be, honest about how much you use so that you can come up with the right plan for you then, for sure.
That's exactly it. Some of us will be like a little more hesitant. We're like, I only smoke half a pack a day because we're embarrassed about how much we smoke. And that's not even, you say you smoke half a pack, but really you're smoking 3/4 to a pack. You need to be honest because, you know what, healthcare providers, they want to help you. They want you to succeed, and they're only going to be able to help you succeed if you give them correct information.
Okay. We have time for one last question. The question is, what's the best thing I can do to help my partner quit?
Take a deep breath. Don't get frustrated. Just speaking from experience, it's really, it can be really challenging because even if we're a healthcare provider, even if we do this for a living, it doesn't matter because we're living with somebody, and it's a very different relationship. And even if you're not a healthcare provider, we get frustrated because we still have this notion that, you should just quit. What's wrong with you? And we watch them go through cycles of quitting and going back and quitting and going back, and we've been with them when they go through those cycles. So when I said just take a deep breath, I kind of meant it. Like just take a deep breath and just realize that they're doing the best that they can. That's the first thing. And to let go of your judgment, and then ask them, what's the best thing I can do to support you? Help them. Ask them what they would like, what they might need, and then go with their cues. And I encourage you to pick up that booklet, Help a Smoker Quit, from the Canadian Cancer Society. It goes into that in much more detail. It's a great resource.
Great. Thank you so much, Monica. That's all the time we have for questions. If we didn't get to your question, we will get back to you in the coming days. Thanks so much, everyone, for joining us. I hope you've enjoyed this webcast as much as I have. And as always, if you know someone who couldn't join us today, this webcast will be available on demand on our online community at cancerconnection.ca. And if you're not already a member of our online community, I invite you to join us at cancerconnection.ca. It's a great place to connect with others, discover your personal journey, and discuss topics of interest like the information that we shared today. Please take a moment to fill out your survey. Your feedback is so important to us. It helps us to develop our future webcasts. And as always, stay tuned to cancerconnection.ca for information on our next webcast. Thanks, Monica. Everyone have a great afternoon.
Thank you.